All right, this is SNL cardio. Let's just finish this the last five questions. So I was on 94. Basically, kid has Kawasaki syndrome. You give him aspirin IVIG. Uh, what's the complication of this? It's a myocardial infarct. It's actually not a myocardial infarct. It's a myocardial um, aneurysm, but it can also lead to an infarct as like the aneurysm is developing. Um, 95 talks about a 37-year-old. We don't know if it's man or male or female. Acute rhinitis, arthritis, hematuria, red cell cast. Oh, this is a renal question. It's a renal question. Skip this. Let's finish it off strong. 20-year-old woman has migraines. This is right. Takes ibuprofen. Okay, you want to give triptans, right? Which is sumatriptan. And basically, what it does is that it does this. It's a 1 dB receptor agonist. It is agonist, right? So remember, you don't remember blood. When blood is coagulating, one of the things that's happening is serotonin, or I don't know if it's coagulation or if it's infection, like one of those reactions. But one of the things that happen is serotonin causes vasoconstriction, right? And migraine is a problem is that the some of the places are vasodilating, right? Some of the like the meninges, stuff like that. There's vasodilation, and that causes pain. So you want to hit the serotonin receptors, in the right spot, right? And 1D1B is the right spot. It causes vasoconstriction in those vessels and aborts the migraine. Next question talks about a 72-year-old pleasant. Um, you don't know guy or girl. There is general weakness and muscle pain. His urine is darker. Let's hope it's not a renal question. Has history of hypertension, diabetes, and dyslipidemia. Oh, it is an interesting question, is what it is. LDL is this, HDL is this, triglyceride is this. So the patient is taking some sort of statin. Oh, it doesn't say what it's taking. So, so the dark urine is because of rhabdomyolysis, right? That's a side effect of, and you got weakness and muscle pain. That's a side effect of statins, right? So you got to see what else they caused. I don't think they do anything with yellow vision, fish oil, flushing, lipoprotein lipase. That's not it either. Maybe that is it. Maybe it's C. Maybe it is C. Okay, so a fibrate plus statin, it makes a cocktail to destroy the muscles, right? And so this question is focusing on the fibrates, right? And this is what fibrates do. They increase the expression of LPL. That's lipoprotein lipase, right? That's basically when you eat fat, it goes into your intestine, it becomes chylomicrons. Chylomicrons go to peripheral tissue, and the enzyme that just like breaks them down and uses the fat and like gets the fat to go into the peripheral tissue is lipoprotein lipase. And that's why fibrates are really good at decreasing tags, right? try acylglycerides. And the other thing about them is that when you use them with statins, you gotta be extra careful. 76-year-old, seasonal allergies, puffy face, acts as a histamine receptor, acts on the histamine receptor. Uh, what is most appropriate? Okay, so you want a histamine blocker. First of all, this, isn't it? This is a type 1. This is maker super. So we got H1s and H2s, right? H2s are for antacids. I think I brought this up like on question like under 5, one of the questions here. But this is for antacids. This is for, I might have been wrong there, but this is right. This is for like allergies. And but the type ones have two subtypes. They have generation one, generation two. Generation one have a good brain solubility. They get into the brain. They antagonize H1, and as they do this, they have all these drugs. They have anti-HAM side effects. HAM is H alpha M. They have antihistamine, anti alpha 1, and anti muscarinic side effects. So, if you give diphenhydramate, which is a type 1 Gen 1, to this patient, especially as old, it's like going to increase the chance of having like some effects with due to anti um, cholinergic, anti muscarinic effects, right? So, we don't do that, such as like dementia, stuff like that. Um, Same with alpha anti alpha 1. So, but the Gen 2s are more direct. This drug is one of the examples of the Gen 2s. Let's make sure I'm not super good at drugs. Okay. 22-year-old. You give him xylutin. What does xylutin do? Okay. Xylutin blocks the enzyme, basically, not the receptor. So, doesn't do anything with this guy, right? His serotonin, that doesn't make sense. Doesn't do anything with the receptor. That's important. Um, the one that does something with the receptor is has another name, another weird sounding name like xylutin, but it's not xylutin. This guy is the enzyme inhibitor. Xylutin is the enzyme inhibitor. Question 100 talks about a 22-year-old pregnant woman who has LDL and THG and HDL of this. She's appropriate treatment for dyslipidemia. Based on her current condition, which are following is the drug that she's been I don't know about this actually. Okay, so long story short, all the dyslipidemia questions, dyslipidemia drugs, if they get into the fetus, they'll destroy it, right? So really, the only thing you can give is something that's not going to enter the patient's body in the first place, and those are the bile stuff, right? The bile acid resins. And these guys will basically bind bile, take bile out of the body, so the liver will make more bile, and that causes using up cholesterol. One thing they do is that because they're taking bile out of your system, they're making cholesterol they're making cholesterol less soluble in the gallbladder, and this girl's pregnant has an increased risk of gallbladder stones. So that's like their side effect. Let's check again. Okay, thank you so much for watching this. This has been a pain, to be honest, because some of the SNL questions are a little out there. But I hope you the purpose here isn't the questions, is the little explanations I give. I hope you learned a lot from however many questions this was. There's going to be also a renal section uh, that I'm going to work on. Hopefully, that's going to have less questions from what I can see. There's a lot more cardio. Yeah, so this is actually where I was talking about where was it? I'm trying to think where I was talking about the H1, H2, and how they have same role as V1 and V2. Not same role, but same intercellular signaling. I can't find it. All right. Thank you.